Modern Dental Assisting, Chapter 61, Communication in the Dental Office. Good communication in all forms is the backbone of a well-run organization. Learning about interpersonal communication allows you to communicate what you mean and to interpret what others say and do correctly. Communication pathways. There are two parts of any message, the statement proper and the explanation. Verbal communication, including words spoken or written, and nonverbal, including body language, posture, movement, and attitude. Listening skills. So when we're listening, we don't want to let our mind wander. Put aside personal concerns while the patient is talking. Don't concentrate on formulating a reply. You should be concentrating on what the patient is actually saying. Look as well as listen. Pick up both verbal and nonverbal information that the patient is transmitting. We never want to stereotype, avoid selective hearing, and avoid impatience. Understanding human behavior. Collection of actions performed by human beings who have been influenced by a person's culture, attitudes, emotions, values, ethics, and authority. Socialization is the process by which society influences individuals, and peer pressure is conforming to the general behavior of a group to feel more accepted in that group. This can be positive or negative. Cultural diversity. Differences must be understood. This can be in gender, race, cultural heritage, age, physical abilities, and spiritual beliefs. Recognize varied verbal and nonverbal language among cultures. Communicating with colleagues. Working in a positive, challenging, and stress-free environment is what everyone wants from their place of employment. The one key to a successful work environment is teamwork. Being a team member will include being flexible and receptive to altering the way responsibilities are performed, being self-confident and using self-initiative when it's time to get things done, showing appreciation to your coworkers, thinking before speaking, not letting emotions get overly involved. Remember that the first impression is not always the right one. Sharing in your ups and downs for the day, and knowing that your way may not always be the right way. Stress can be caused in a few different ways in the dental office, but some of them listed below include lack of staff, overbooking, multiple tasks that would be required simultaneously, lack of communication, and perceived lack of job advancement. Conflict amongst coworkers, if differences or conflict amongst colleagues are creating stress, learn how to work through those differences by engaging in team building dialogue. Conflict is necessary for effective problem solving and for effective interpersonal relationships. Unfortunately, unresolved conflict usually tends to escalate. It's better to talk it out when you first notice it. Communicating with patients. Effective communication is important in achieving patient satisfaction. Patients who have good relationships with their dentist and their dental staff are likely to stay with the practice. They're likely to accept treatment and pay for treatment, and then also more likely to invite their friends and family to come to the practice. Patients base their perceptions on how they're treated on the phone, how they're greeted, how they're made to feel in the office, how efficiently the staff manages business aspects like billing and insurance. psychological reactions, anxiety and fear and pain, dental phobia, physical and mental needs, and then also financial strain. So patients would like to have a positive atmosphere, sincerity. They like to be shown respect and respecting their time, quickly resolving complaints and misunderstanding. They want a staff who is approachable and, of course, respecting and maintaining patient confidentiality. Telephone skills. The phone is most important piece of equipment in public relations. So, as the dental assistant, we want to understand etiquette on the telephone, how to manage incoming calls and outgoing calls, dealing with difficult calls, placing patients on hold, how to manage callers who want to speak with the dentist, and then also taking messages. Messaging systems include voicemail, answering machine, answering services, text messaging, emailing, and then teledentistry. Written communications, including letters. So, types of letters, including letters to colleagues, insurance carriers, how to format business letters, an anatomy of a business letter, and then preparing envelopes for mailing. With marketing, we want to have great goals, logistics, and then we can do marketing and advertising. There's a lot of web marketing now, doing a blog or with social media. We're seeing a lot of social media, health fairs, newsletters, brochures, thank you gifts, and then also birthday greetings.